تمام. بسم الله الرحمن الرحيم. Presentation today about bold. كده صوت كده مظبوط. Bold and diffusion MRI in urinary bladder cancer predicting the histologic grade and muscle invasion. Urinary bladder cancer is the most common urinary tract neoplasm. Precise assessment of the truther muscle invasiveness is crucial for management decisions. The TURBT and intravesical therapy are the preferred treatment options for non-muscle invasive bladder cancer. In contrast, the muscle-invasive bladder cancer needs more aggressive management combining the chemoradiotherapy and radical cystectomy. Histological assessment is the gold standard for tumor grading, yet the sampling bias and tumor heterogeneity undermine its effectiveness, calling for non-invasive tools capable of addressing risk stratification metrics such as the truther muscle invasion and histologic grading. MRI is a pivotal player. It is the most effective imaging modality for local staging of bladder cancer, detecting the invasion into the muscle, perivesical tissue, and adjacent organ. Nevertheless, anatomical sequences are limited in tissue characterization. The efficacy and reproducibility of non-invasive MRI techniques such as diffusion-weighted and T2-star gradient imaging for evaluating different tumor types in different clinical settings. The diffusion-weighted image probes the tissue microenvironment by addressing the tissue molecular motion and quantifying it by ADC. It is widely become a diagnostic and biological behavioral biomarker. It also helped in the local staging of bladder cancer, reducing the need for re-TURBT due to unsuccessful initial procedures. Bold MRI is a T2-star based non-invasive technique, monitors the paramagnetic properties of the oxyhemoglobin to measure the oxygen bioavailability in the tissue by detecting the apparent transverse relaxation rate, the R2-star, alterations on multi-echo gradient images. The R2-star maps generated and providing quantitative data on the tumor oxygenation level and has been recently deemed feasible in many neoplasms like breast cancer, prostate cancer, brain tumors, and head and neck cancers. Hypoxia occurs when the rate of oxygen delivery to the tissue is inadequate to meet its demand, and the tumorous tissue contains disordered angiogenesis, makes the oxygen delivery inefficient, leading to the hypoxia. Hypoxia also recognized the hallmark of cancer and a negative prognostic factor for many solid human cancers. It also known to be a cause of radioresistance, result in the failure of radiotherapy treatment, and more recently also implicated in failure of chemotherapy regimens and numerous targeted therapies. The effect of hypoxia increase the therapy resistance, and this will lead to more malignant progression and the more tumor migration and metastasis. Hypoxia also triggers the production of hypoxia-induced factors and activation of other cancer metabolic signal, and maintain a vicious circle of hypoxia-dependent tumor plasticity and invasiveness, and all this correlate to the higher grade and local invasiveness in many tumors. So, bold MRI considered a persuasive contrast-free functional imaging approach and a biomarker for hypoxia. It is potential to identify a patient with hypoxic tumor that will have benefit from the hypoxia modifying therapy and accelerated radiotherapy. This is the protocol for the diffusion and T2 bold MRI sequence on 3 Tesla MRI. This is a study by Wang et al. 2020, studies the application of R2-star and EDC and assessment the grade and stage of the bladder cancer. It revealed that higher values of R2-star in higher grade and muscle invasive group, and the ADC showed lower values in the high grade and muscle invasive group compared to the low grade and non-muscle invasive groups. This is a recent study at 2025 also showed the higher R2 star values in high grade tumors and muscle invasive group compared to the low grade and non-muscle invasive group. The ADC values were also low in the high grade and muscle invasive compared to the other groups. And there is inverse relationship between the ADC and the aggressiveness of the bladder cancer. Combining the diagnostic performance of R2 star and ADC together yields a higher accuracy, especially for the prediction of the grade of the tumor. This is a case of 60-year-old male patient presented with hematuria. As we can see here. معلش البوينتر فين؟ pointer. اهو ده. ليزر بوينتر. تمام كده. اهو تمام اوكي. بس شكرا. This is T2 axial T2 images that showed polypoidal mass lesion, and this is the T2 hypointense intact muscle layer, and this is the corresponding the high p-value diffusion, and EDC image showed restricted diffusion with the mean value for this case ADC about 1, and this is the corresponding R2 star image with mean calculated mean R2 star value 12.3, and this was pathologically proven low-grade non-muscle invasive bladder cancer. Another case, 67-year-old male presented with hematuria and dysuria. The axial T2 images showed polypoidal bladder lesions with stalk here and perivesical desmoplastic reaction. It showed no restriction in diffusion. This is diffusion image, and the tumor seen restricted here with calculated mean ADC value for this case about 0.62. It is very low, and the R2 star value is 20.2, and this was pathologically proven high-grade non-muscle invasive bladder cancer. This is a case, 73-year-old male patient presented with hematuria, and there is bladder lesions involving the anterior right lateral and posterior walls, and this is the high B value, showed marked diffusion restriction with calculated mean ADC value about 0.47. This is very low. And corresponding R2 star map showed calculated value about 26.5, and this was pathologically proven muscle invasive bladder cancer. Integration of the bold and diffusion into the pre-operative evaluation of bladder cancer holds great promise, improving the accuracy of prediction of the tumor grade and intrusive muscle invasion, and all this will lead to patient will be benefit from organ-sparing surgery, refined treatment decision-making, optimizing surgical planning, and all of this will lead to improved patient outcome. Thank you.